Do your eyes ever get really light sensitive? Are you concerned that it could be something dangerous? Or maybe you just want to figure out how to make your eyes feel so much better. In today's video, we are getting into all the different reasons for light sensitivity, what you can do about light sensitivity, and when you actually need to worry about your eyes being light sensitive. Hi everyone, my name is Dr. Saya Nagori. I'm a board certified ophthalmologist. I'm also a glaucoma specialist, and I have many patients who struggle with light sensitivity. So in today's video, we are going to talk about all the different reasons for it and how I advise my patients to deal with their light sensitivity depending on what is causing it. Another word for light sensitivity is photophobia. Photo implies light and phobia meaning fear. But this is not an emotional fear. It is when people need to avoid the light because of the frustrating symptoms it can cause them. Light sensitivity can come from many different eye and health conditions, and some people only notice it when they step outside into the sun, and some people struggle with it all the time, even indoors, or even when the lighting is low, or even when they're staring at screens in a dark room. Let's look at the 7 most common reasons for having photophobia or light sensitivity, how you can manage them, and then we'll talk about some of the concerning causes that you really would want to get screened for right away. Let's start with number 1, which is dry eye. So having dry eye is one of the most frequent reasons for having light sensitivity. When your eyes do not produce enough quality tears, the cornea becomes unstable and it can become irritated. This can create a burning or stinging sensation, and even normal amounts of lights can feel overwhelming. And this sort of hypersensitivity to light can be caused by dry eye. So treatments for this include something that is pretty simple, like over-the-counter artificial tears. You're gonna want to try to get some that are preservative-free ideally, because preservative-free tears can really help to stabilize that tear film. Now, another thing that you can do completely on your own at home is just adjust your environment. So for example, using a humidifier can be very helpful. Avoiding fans that could be blowing air directly into your face can also help to reduce symptoms. If you're driving a lot and the air conditioning vent is blowing right at your face, that can also aggravate dry eye. Also, you can buy an eye mask, and sleeping with an eye mask can help you to keep your eyes closed at night, which can also help to relieve symptoms of dry eye. Sometimes patients don't even realize it, but they may be sleeping with a little bit of their eye open, and that can result in overnight exposure, which can make the eye more dry. These patients may notice that they're way more light sensitive right when they wake up in the morning until that cornea has had time to really re-lubricate itself. Now, good eyelid hygiene is also a huge part of dealing with light sensitivity, because eyelid hygiene has to do with dry eye. So if your eyelids have blepharitis or inflammation, and there's another video on the channel all about meibomian gland disease. The meibomian glands are these small glands that sit in the eyelids, and so be sure to check that out if you feel like your eyelids are also kind of puffy red or inflamed. But the way you treat blepharitis is using warm compresses to sort of relieve that any clogged oil glands in the eyelid. By doing the warm compresses, the oil is allowed to sort of exit the eye, and then you're gonna wanna use a soapy warm water wash to just kind of get that debris off. All of this can help to treat dry eye, which could be a cause of light sensitivity, and it's actually a fairly common cause of light sensitivity. Now, the second most common reason for having light sensitivity is having uncorrected vision, which means that maybe your eye prescription may not be accurate anymore, and then this can lead to digital eye strain. Light sensitivity from not wearing the right glasses or contact lens prescription can cause your eyes to work harder than they should, or you may be keeping your eyes open for longer, which again can relate back to dry eye because you are not blinking as frequently, and that means the tears are just not being distributed over the eye as frequently as they should. Now, also, hours of screen time associated with a prescription that may not be correct can also cause a lot of visual strain, which can also appear as light sensitivity, especially for people who have jobs where they are staring at a screen all day long. So, if you're an accountant, or if you work in human resources, or really pretty much most of the jobs these days involve a computer. So you may be getting more light sensitive because your eyes are just doing more work on top of an issue like dry eye or your prescription not being right. So of course, the solution to this starts with correcting your refractive errors. So go into the eye doctor, make sure your glasses are up to date. You can also help with this issue by taking regular breaks from screens and also remembering to fully blink to just give your eyes a break and replenish that tear film over the cornea. Sometimes reducing the brightness on your devices can also be helpful. When it comes to light sensitivity, wearing blue light glasses can also be helpful for some patients, but there haven't been enough good studies to show that it is a true clinical solution for light sensitivity. However, I do have patients that feel like their light sensitivity is made better when they are wearing the blue light glasses. So I certainly think there's no harm to it and it's something you can try. Another cause for having light sensitivity is having migraines. So if you are someone who has migraines, then you already know that severe light sensitivity can happen during an attack. So this is really important to have co-management with your eye doctor as well as your neurologist, or if it's your PCP who manages your migraines. For relief from migraines, people can often rely on medications like over-the-counter pain relievers as well as stronger prescription drugs. So in this situation, using eye drops or updating your glasses prescription may not necessarily work if the problem is really from the migraine. So you may want to talk to your doctor about preventive medications as well as lifestyle changes. So for many people, migraines have certain triggers, and improving sleep and avoiding triggers, as well as practicing stress management techniques, can also reduce episodes of migraine, as well as the light sensitivity that can come along with it. Light sensitivity and eye allergies. So unfortunately, allergic conjunctivitis can make the eyes very red, watery, and sensitive to light. With allergies, you're gonna wanna reach for those antihistamine eye drops, and these can be very, very effective. So if your eyes feel itchy and light sensitive and you have a history of allergies, so you're someone who starts to sneeze when pollen is high, then you may want to consider also using a daily oral pill like loratadine or sertrazine to help manage all of your allergy symptoms. Artificial tears can also be helpful, but I find that using the oral pill and some anti-itch medication can really help to calm that down, and then you can layer the artificial tears on top of that. Remember to always check with your doctor for what's right for you. Now, viral conjunctivitis, which is also pink eye, can also cause light sensitivity, and this is just going to improve with time and supportive care. So what's interesting is when people have pink eye, they think that they need antibiotics, and unfortunately, truth is that antibiotics typically will not help pink eye because most pink eye is viral. So if you do have a conjunctivitis that is bacterial, then yes, you will need antibiotics. But if you have a viral pink eye with light sensitivity, then you're just gonna wanna use comfort care, which is gonna be artificial tears, cool compresses, and try to avoid situations that are hurting your eyes. Viral conjunctivitis does resolve on its own after 2 to 3 weeks, but you should be keeping your visits with eye doctors because you want them to make sure that it is not bacterial and that you don't have any after effects from the pink eye itself. Now let's talk about light sensitivity that's associated with corneal scratches, which is called a corneal abrasion or a foreign body, like something stuck in the eye. So this is going to be a fairly obvious cause of having light sensitivity because you will have an event where you know that, hey, something went in my eye and now I'm in pain and having light sensitivity. So if that does happen, it is pretty important to get into the eye doctor because for corneal abrasions, you do want to be put on an antibiotic, and corneal abrasions are typically extremely painful, so it is not something that's going to be a mild symptom usually. Now for foreign bodies, the weird thing about foreign bodies is that sometimes they can fall out on their own and you may still feel like something is in there. So again, with scratches and anything like a foreign body, you want to go into the eye doctor and get that checked. Now a more concerning reason for light sensitivity is something called iritis or anterior uveitis. This is inflammation inside the eye and it causes pain and it can be much worse with bright light. So unlike milder conditions, uveitis actually requires prescription treatment with steroid eye drops, and your eyes may also appear kind of red. This type of eye inflammation can be associated with different types of chronic diseases like rheumatoid arthritis or having an HLA-B27 positivity. You can also get eye inflammation or traumatic uveitis from trauma, which is, maybe being hit in the eye or if you've been in a car accident. Again, the treatment is the same. You're going to want to use those steroid eye drops, but in this situation, the doctor's going to want to make sure there's no other signs of damage like a corneal abrasion from the trauma itself, because we don't really want to use steroids in a case where there's an abrasion where we would want to use antibiotics first. So this is something that you're going to want to go into the eye doctor for, not something that I would recommend trying to manage at home. Now, some more serious causes of light sensitivity, which are unlikely to happen, but could be a cause of it, are something infectious like infectious keratitis or something like angle closure glaucoma. These typically tend to have a lot more symptoms than isolated light sensitivity. So in this situation, you would be going into the eye doctor as soon as possible. The key is to really pay attention to your symptoms. So if you're having really severe symptoms, you're going to want to go in. If your eye is really red, I would also recommend that you go in and get a proper evaluation. But if this light sensitivity is something that you're experiencing every day and you think it is from something more mild, like dry eye or digital eye strain, then try using some of the more conservative methods, and always check with your personal eye doctor on how you should handle your personal eye care. Hope you found this helpful. Remember to hit like and subscribe below. And if you have any other questions about light sensitivity, drop them in the comments and I'll try to answer them in a future video. Thanks for watching.